Welcome back to EduSkills. OET made easy. Our mission is to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. All the services from EduSkills is free of cost. There is no type of payments. So please don't entertain those messages asking for payments by spammers. And today we are going to deal with a wonderful segment that is Reading Part C. And in fact, the most entertaining segment of the OET subtests. Let me share my screen. Okay, OET skills, Reading Part C skills. And the text we are going to look into. The system will read it for you. Listen. This is also a listening practice for you.
15. What possible reason does the writer give for refusing current smokers the opportunity for surgery? A. The negative effects seen in systematic research. B. The overall increased costs to the hospital system. C. The known impact on the patient's heart and lungs. D. The higher possibility of post-operative infection. Smokers who do not try or do not succeed in quitting should not be offered a wide range of elective surgical procedures, according to an editorial published in the Medical Journal of Australia. The authors acknowledge this would be a controversial, overtly discriminatory approach, but they say it is also evidence-based. Dr. Matthew Peters and colleagues from Concord Repatriation General Hospital say smokers who undergo surgery have substantially higher risks, poorer surgical outcomes, and therefore consume more healthcare resources than non-smokers. Surprisingly, these new concerns are not based on cardiac and respiratory risks but increased wound infection.
Okay, if you have no distractions at the background, you can interact with me. Let's enjoy this. Now, could you tell me what is the main hedging word in the question statement?
Infection.
I mean, the hedging word, question statement. Question statement is this: what possible reason does the writer give for refusing current smokers the opportunity for surgery? What is the main hedging word?
Reason for
Reason. Yeah.
possible reason.
Yeah. Yes, reason is the main word. So we have to look for a reason, right?
Yes.
We should have to look for a reason. Now, can you find somewhere a synonym of reason in the paragraph? Synonym of reason.
Evidence.
Evidence, exactly. Evidence. Evidence is the synonym of reason. This also tells us about a strategy. If you have attended my previous sessions or watched the videos, see, the thing comes after a contrast word. Okay?
Yes.
Thing comes after a contrast word. Now, here, after this, do you have any idea? Here, what are the main words here in the answer options?
Negative.
Effects. Increased cost.
Negative effects. Okay, one is about effects. Will it be the answer? They are asking about reason. No, reason, and can effects be the answer?
No.
Never. See, when they ask for reason, reason should be the answer. Okay?
Yes.
Anything else? Here, second one, what is the hedging word?
Cost.
Cost. Okay, cost. Then
Impact.
here, third one, impact. Impact. Can it be the answer?
No. No, Father.
No, because they are asking about, they are asking effects and impact is same, so that cannot be the reason. Okay. Next one.
Post-operative.
infection. This is answer for
Post-operative infection. Where do you find it in the text?
last
increased wound
infection.
And what is this known as? Here, something I am highlighting here, surprisingly. That is reading for
Emotion.
reading for emotions, exactly. Reading for emotions. Whenever some emotions are expressed in a passage, that is a clue to the answer. Surprisingly, these new concerns are not based on cardiac and respiratory risk, but increased wound, increased wound infection. Again, there is a contrast word. So that again tells you there is the answer. Increased wound infection, possibility of post-operative infection. That is the paraphrasing. So you have the contrast word here, the synonym here, the reading for emotion here, again contrast word. Again, you will have to look into the topic sentence. Okay, which is the topic sentence? This is the topic sentence. Okay. Smokers who do not try or do not succeed in quitting should not be offered a wide range of elective surgical procedures. Immediately the question is why? Why they should not be offered or given a wide range of elective surgical procedures? So the answer is the reasons. Then you have reasons here. Many reasons given, right? Higher risk,
Higher
okay.
possibility.
Poorer surgical outcomes, then consume more healthcare resources. All these are the reasons. This is a structure of the paragraph. When you practice, you have to practice this way. Don't hurry, don't find. It's not, it doesn't matter whether your right answer is right or wrong. Understand why your answer is right, why your answer is wrong. So to go in detail, understand these things. Okay, again, certain things I told you here. See, when you read, you know, here you see Dr. Matthew Peters and colleagues from, see, all these things are, you can just eliminate when there is something about the, yeah. There you can read directly, Dr. Matthew Peters and colleagues say smokers who undergo surgery have substantially higher risk and all those things. So ignore the subject complements. So this is speaking about from Concord Repatriation General Hospital is speaking about them, about where are they from. And sometimes even you can ignore these things. You can say, somebody says, ignore, even colleagues. Yeah. Dr. Matthew Peters says, smokers who undergo surgery have substantially higher risk. Got it?
Yes. Yes, sir. Yes, sir.
So this is how I have highlighted these things. So you have topic sentence here. You have contrast word as the clue or strategy or tips, whatever you want to say. Then ignore the subject complements. Look at the synonyms, reasons, evidence. Okay. Now let's look into one more question. Listen, okay.
According to the writer, what causes occasional outbreaks of preventable diseases are: A. High prevalence of disease, B. Limited access to vaccination, C. A. Low prevalence of vaccination. Attitudes towards vaccination. A recent outbreak of chickenpox is a reminder that even in countries where immunization rates are high, children and adults are still at risk of vaccine-preventable diseases. Outbreaks occur from time to time for two main reasons. The first is that vaccines don't always provide complete protection against disease, and, over time, vaccine protection tends to diminish. The second is that not everyone in the population is vaccinated. This can be for medical reasons, by choice, or because of difficulty accessing medical services. When enough unprotected people come together, infections.
Okay, after infections, there should have been a full stop, right? Yes. So what is the hedging word in the question stem?
So the causes.
Causes.
Yes, causes. This is what you have to identify first. Now causes, that will help you to find causes. Causes.
Reasons.
Okay. Yeah, causes. Now you know any synonym of causes here? Reasons. Reasons is the synonym of causes, right? Now in the question word there is one word occasional outbreak. Occasional is the time expression, right? Frequency expression. Okay. Frequency expression. So coming to this one, coming to options. What are the hedging words?
High prevalence.
High prevalence. High contrast with something in the hedging word here on the question stem. Question stem says occasional outbreaks. This says high prevalence, means not occasional, always. No? High prevalence means very often. Occasional means sometimes there is outbreak of preventable diseases. So this is the opposite, right? Did you understand? High prevalence, occasional outbreaks. High prevalence of, this one says high prevalence of disease. Here it says occasional outbreaks of disease. So occasional is opposite of high, or you can say it is not the same. Okay, if you can use the scale here, high. Okay, then occasional, sometimes, always, sometimes. Then next one,
Limited.
yeah,
Limited.
what is that?
Limited.
Limited
Vaccinations.
access to vaccination. Okay, access to vaccination. Then
Low
low
prevalence.
prevalence of vaccination is the concept. Okay, then below, attitudes towards vaccination. Okay, now access, prevalence, attitudes. These are the three things you have to look into. Now, what could be the answer? You have to look for a reason. So it speaks here about two main reasons. So you definitely the answer comes after that, right? Not before that. Got it? So you have to concentrate much more on what comes after reasons, because according to the writer, what causes or reasons are given for occasional outbreaks of preventable diseases. So they are speaking about outbreaks occur from two main reasons. So reasons come after that. So you should not waste your time reading the things here in the beginning stage here. This is not relevant for answer. Okay? Do you get me?
Yes, Father. Yes,
Yeah.
Father.
Now
Yes,
you have to see here the time expressions. Now we need one reason. Many main reasons are given. Many reasons are given. The first reason. What is it?
Chronological.
Yeah. Chronological is that vaccines don't always provide complete protection against disease, and over time vaccine protection tends to diminish. The second, one of these should be the, if you remember, I have taught you the paragraph structure. When there are reasons or causes or evidence asked, first, second, third, one of them will be the answer. Second one, that not everyone in the population is vaccinated. Not everyone in the population is vaccinated. Is there any paraphrasing or the synonymous language in among any of the options?
Low prevalence. Low
Yeah,
prevalence.
not
of
low
vaccination.
prevalence. Yeah, a low prevalence of vaccination is the paraphrasing of not everyone in the population is vaccinated. First reason, vaccines don't always provide complete protection. Second reason, everyone in the population is not vaccinated. A low prevalence of vaccination. Is that clear?
Yes.
Yeah. So this structure is very important. Okay. Let's see the structure. See, this is the structure I taught you. Do you remember? When reasons are asked, now we had two reasons. The structure is, one point is said about the vaccination and the prevalence of preventable diseases. Then the problem, then reasons discussed. 1, 2, 3. We have only two reasons in this paragraph. So I said one of these must be the answer. So don't dedicate or spend your time here in the initial part of the text. Run into the synonyms or the word reason, where you find the word reason. Okay. See, other structure I said there will be a point, a problem, solutions discussed. Instead of reasons, they can also discuss solution 1, solution 2, solution 3. One of these solutions must be the answer. Okay. The other one is structure. If benefits are discussed, benefit 1, benefit 2, benefit 3, benefit 4, one of these benefits must be the answer. So look into the synonyms or advantages. Then advantage 1, advantage 2, advantage 3, advantage 4. So one of these advantages will be the answer. So why I'm giving you this, focus on the structure and understand, especially when you are practicing in the initial stages, you have to focus on the structure of the whole thing. Are you ready for the next one?
Yes, Father.
Yes,
Yes, Father.
Yes, Father.
Yes, Father.
16. In the second paragraph, Dr. Peters says that prioritizing patients A is unfortunately necessary. B is less expensive in the long run. C should start at a government level. D has been shown to reduce harmful outcomes. A randomized study examining smoking cessation intervention before joint replacement surgery saw wound infection rates reduced from 27% in continuing smokers to 0 in those who quit smoking, Dr. Peters said. Almost 8% of breast reconstruction patients who smoke experience abdominal wall site necrosis, compared with 1% of non-smokers. These results are obviously significant. He believes that it's much better that the prioritization occurs on the basis of good evidence rather than on a whim or some political influence. If there was a healthcare system that had everything patients need and want immediately, there wouldn't be a problem. But we don't have that, and as far as I'm aware, no country truly does. You have to determine priorities, Peters says.
Okay, now what we have to focus in the question stem
Name
as per the
criteria.
strategies?
Name
Name has to
Dr.
be
Peters.
name has to be focused. So do you have the name in the paragraph? In the
Yes,
text?
yes,
Yeah,
Dr.
for the
Peters.
third
Yes.
line.
Dr. Peters.
Dr. Peter
Says.
says. And here says
Said.
means it
Said.
is opinion. Here it is said.
Said.
Opinion.
Said.
Okay, his opinion. Do you have any other word in the text below this where it speaks about opinion? Opinion
Last
words I
line,
have
Father.
taught you.
Last.
He
He
believes.
believes, exactly. He
Believes.
believes. Believes is the synonym or the opinion word. So answer should be where he believes. After he stands for? He stands for?
Dr.
Dr. Peter.
Dr.
Yes.
Peters.
So answer must be after the name. When you have a name, immediately swoop into the name where you find in the text, and the answer will happen after that. Now, let's see the hedging words in the options. Unfortunately. What is it? What is it?
Negative. Negative.
No, it's about reading about emotions. Unfortunately, I could not do that. Unfortunately, I lost one subtest. That's emotion, right?
Yes.
Unfortunately, it's reading for emotions. Whenever there is an emotion, I said answer must be somewhere there. That is a strategy. Let's see whether it is there. The second option speaks about less expensive. Means expense. The concept is expense. And sorry, I should not put it red because we have not decided which is the answer, right? Okay, yellow. Then should start at government level. Who has to do it? This speaks who has to do it. Okay. The third one, fourth one.
Reduce
Outcomes.
harmful
Outcomes is the concept.
outcomes.
Outcome is the concept. Here it says expense. In the second option, expense is the concept. If you remember, I taught you you have to find out the concept-based edging words as well as the differentiating edging words. Here, second one is who has to do it, and government. And here it is outcomes, harmful outcomes. So you see the concepts. Okay, these are the concepts. Now, as per the formula or the strategies we have learned, if there is a emotion expressed, that is important. Let's see. After he believes, do you have anything connected to A option?
Rather than further.
Hmm? Do you have, where do you have the answer? Now, do you have any other strategy after he believes?
Prioritization occurs.
Okay, on the basis of good evidence rather than on a whim or some political
Evidence
influence.
rather than.
If there was a healthcare
If there was a healthcare system that had everything patients need and want immediately, there wouldn't be a problem. But what is it?
But
Contrast.
If there is a contrast word, answer must be answer after the contrast word.
that.
So you have to look here. Do you have anything synonym to? We don't have that, and as far as I am aware, no country truly has. Listen once again to just the paragraph text portion of it. Okay, listen carefully.
A randomized study examining smoking cessation intervention before joint replacement surgery saw wound infection rates reduced from 27% in continuing smokers to 0 in those who quit smoking, Dr. Peters said. Almost 8% of breast reconstruction patients who smoke experience abdominal wall site necrosis, compared with 1% of non-smokers. These results are obviously significant. He believes that it's much better that the prioritization occurs on the basis of good evidence rather than on a whim or some political influence. If there was a healthcare system that had everything patients need and want immediately, there wouldn't be a problem. But we don't have that, and as far as I'm aware, no country truly does. You have to determine priorities, Peters says.
Did you understand? See, prioritizing patients is not a good practice. But unfortunately, we have to do it. Every patient has right for every treatment, right? And we should not prioritize. But here they say, unfortunately, we have to do it because we haven't got sufficient or, a healthcare system had everything patients need and want immediately. We don't have. So, unfortunately, we have to do it. Is that clear?
Sir, cannot be C
See,
according to my think.
where
Sorry
do
for
you have?
interruption.
Yeah, it's cool. It's cool. You're welcome. Where do you find the reference in the this one paragraph?
No, sir, not from the paragraph. This is the last sentence. I'm aware no country truly does.
But we don't have that. And as far as I am aware, no country truly does. C option says should start at a governmental level. What is the meaning of I am aware no country truly does? Not this year. Here it is saying that prioritizing patients should start at a governmental level. Prioritizing patients. You have to read the options with the question stem. In the second paragraph, Dr. Peter says that prioritizing patients should start at a government level. But here they are not speaking about prioritizing. If there was a healthcare system that had everything patients need and want immediately, there wouldn't be a problem. But we don't have that. Have that means what? That refers to a healthcare system that had everything patients need and want. And as far as I am aware, no country truly does. Means what? No country has a healthcare system that had everything patients need and want. Did you get it?
Yes, Father.
Here entirely the concept is different. They are speaking the country truly does. They are not speaking about prioritizing patients, but they are speaking about a healthcare system that had everything patients need and want. Okay. So this prioritizing patients has now connection to this concept. Is that clear? This needs a bit of competency because when you should be able to read for the emotions. Emotions will not be mentioned there. They will not cry. They will not laugh. They will not say do any express. They may not give any expressions, but the words will say. See, for example, if there was a vaccine in India for the new COVID variant, it would have been we would have been happy. But we don't have that vaccine. And as far as I am aware, no country has invented a vaccine for the new variant of the COVID. What does it mean? It's so unfortunate. It's so unfortunate. Here, the whole concept is this. The paragraph structure is ulta, like the normal triangle. Topic sentence, important sentence at the end of the paragraph. They start with the two examples, developing sentences. Do you see here? First example is a randomized study examining smoking cessation intervention before joint replacement surgery saw wound infection rates reduced from 27% in continuing smokers to 0 in those who quit smoking, Dr. Peter said. That is one developing sentence, means example or illustration or evidence. And second developing sentence, almost 8% of breast reconstruction patients who smoke experience abdominal wall site necrosis compared with 1% of non-smokers. Second developing sentence or illustration. These results are obviously significant. Peter believes, that it's much better that the prioritization occurs on the basis of good evidence rather than on a whim or some political influence. He believes.
Excuse me, Father.
Yeah. Yeah.
That evidence you are telling, two evidence are showing D option is there, no, Father. Reduce harmful outcomes. Why can't
Right.
we can choose that one, D option?
Prioritizing patients has been shown to reduce harmful outcomes. Do they speak anything about outcome?
No, they are telling necrosis that percentage and percentage is reduced like that.
About reduced in whom?
Almost
Non-smokers or those who quit the smoking. It is the example given for example, here you see those who quit smoking, 0% in those who quit smoking, and 1% of non-smokers, means those who don't smoke. Both are same. Those who have quit, those who are not smoking, they are non-smokers. They are giving evidence about the influence of smoking or the impact of smoking or not smoking on patients. Infection rates in the patients. Now, ultimately, the idea here, the problem we haven't looked into the sequence of the text. This is speaking about those who are not ready to quit the smoking, and they have a lot of infection. What should you do? What should you do? Should you give the immediately perform the surgery, or force them, or encourage them, or motivate them to abstain from smoking at least for 3 or 4 weeks time?
Okay, Father.
Prioritizing patient has been shown to reduce harmful outcomes. Reducing harmful outcomes is not due to prioritizing patients, due to not smoking or quitting smoking. Harmful is reduced due to non-smoking. Harmful effects are reduced when there is no smoking, 0% and 1%. Whereas among smokers, it is 27% and almost 8%. Do you get me?
Yes, Father.
Okay. Anyone else has any doubt?
No, Father.
No, Father.
Okay. Cool. That requires a little competency because you have to practice percent you can see. But then this is all developing sentence, from here to here. This is developing sentence, and the questions are normally based on topic sentences or important sentences. Here, the answers will not occur because to both of these are giving what the impact of smoking and infection, wound infection. That's how you have to understand. This is what I have highlighted in with a shade is 2 examples, illustrations or developing sentences give to illustrate the harmful impact of smoking on wound infection rates. Now, we are supposed to, Dr. Peter believes based on these examples, illustrations, that is much better that the prioritization occurs on the basis of good evidence rather than some political influence, on a whim or some political influence. If there was a healthcare system that had everything patients need and want immediately, there wouldn't be a problem. But we don't have it. Shall we go forward?
Father, what is
Yeah,
the
please.
meaning of on a whim?
On a?
On a whim means what does it mean, Father?
Yeah, that's what the OET is asking you in the next question. Let's go to the next question. Okay? Yes, next question is this. Let's see. Okay, sorry, here I have to highlight this. That is while copying, I did not highlight. Okay, Jyoti, you will find the answer now, okay?
Okay,
On
Father.
a whim. On a whim should be highlighted in the text as well as in the question statement. Now let's listen to this. Then you will understand what is the meaning.
17. In the second paragraph, the writer uses the term on a whim to show Dr. Peter's belief that A. Further research should be carried out. B. Current healthcare systems are not adequate. See, the findings of recent research are remarkable. The careful consideration is extremely important. A randomized study examining smoking cessation intervention before joint replacement surgery saw wound infection rates reduced from 27% in continuing smokers to 0 in those who quit smoking, Dr. Peters said. Almost 8% of breast reconstruction patients who smoke experience abdominal wall site necrosis, compared with 1% of non-smokers. These results are obviously significant. He believes that it's much better that the prioritization occurs on the basis of good evidence rather than on a whim or some political influence. If there was a healthcare system that had everything patients need and want immediately, there wouldn't be a problem. But we don't have that, and as far as I'm aware, no country truly does. You have to determine priorities, Peters says.
Okay, now. So what is the meaning? Jyoti is almost in tune with OET mind. Okay. Jyoti can answer now. So
D,
here there is the
Father.
hedging word is, immediately you have to go to the highlighted word. Now, first one says, on whim, to show Dr. Peters' belief that further research should be carried out. Current healthcare systems are not adequate. The findings of recent research are remarkable. Careful consideration is extremely important. Any idea? See, he
D.
believes that it's much better that the prioritization occurs on the basis of a good evidence rather than on a whim or some political influence. Prioritization occurs on the basis of good evidence. Do you have anything synonymous or synonym?
Research.
See further,
A.
the finding of research.
Yes. Yeah, no. Is it the answer? The findings, see, in the second paragraph, the writer uses the term on a whim to show Dr. Peters' belief that the findings of recent research are remarkable. Did he say that? That's why I said this,
No, Father.
this portion is not important here. Even the previous answer. You have to concentrate on paragraph structure and the thing. Here, only thing you can understand examining smoking cessation intervention. Okay, that's the only thing you can focus on in that part. Examining smoking cessation intervention before joint replacement. Okay. Here, the answer should be here. Dr. Peter believes. He believes. Dr. Peter, whim to show Dr. Peter believes that it's much better that the prioritization occurs on the basis of good evidence. Prioritization has not occurred. It has to occur. Okay, it should be done on the basis of good evidence. If you have to do on the basis of good evidence, what you have to do? Where will you find evidence?
Further research should be carried out.
Careful consideration.
No.
Careful consideration.
Careful consideration. Evidence means careful consideration, right?
Okay.
Okay. Careful consideration is extremely important. Don't go with your whims and fancies on a whim or for some political influence. Whim means what? She is living according to her whims and fancies. Means what?
According
In
to her
Malayalam?
wish.
Yeah, according to her wish means it is not according exactly her wish. Thonivasam in Malayalam.
പെട്ടെന്നുണ്ടാവുന്ന ആഗ്രഹം.
Yeah. അവർക്ക് തോന്നിവാസിയായിട്ട് ജീവിക്കുന്നു. It shouldn't be on your തോന്നൽ. It should be based on clear evidence, which means careful consideration is extremely important, rather than on a whim or some political influence. That is the opposite of prioritization on the basis of good evidence. Is that clear?
Yes, Father. Yes, Father.
Okay, now,
Yes,
for
Father.
example, here you have the name, but you don't require name and other things because you have the highlighted word. So immediately you can go to the highlighted word. The principle is that answer should be next to the highlighted word or not the previous sentence, nowhere else. In the what you call lexical questions, answer will be soon after the most of the time it will be after onevim, after that word, or prior to that word. Means in that sentence or the next sentence, nowhere else. So you need not search anywhere, you need not go behind the name. Otherwise, Dr. Peters, you have he as the Dr. Peters referent. So, and belief, you have beliefs here. So that will say a clue. If you don't find the highlighted word, you can find this. Definitely the highlighted word is the easiest way to reach the spot for the answer. Can I move on?
Yes,
Okay,
Father.
Father.
I think it's too much for you. Should I stop?
No, Father.
Please continue, Father.
Okay. One more will do. Listen now.
18. In the third paragraph, Professor Coates says that treatment should be provided A to all patients based on a system of merit, B according to the necessity of the individual patient, C regardless of a patient's lifestyle factors, D once a patient has reduced their intake of cigarettes. However, not everyone agrees. Professor Andrew Coates, Dean of the University of Sydney's Faculty of Medicine, believes this is not accepted medical treatment. You do not arrange patients based on them being more deserving or less deserving. You give treatment based on need and how a person will benefit. It's the urgency of that need that's the main factor. Coates says lifestyle factors should only affect treatment in very limited circumstances. If, because of lifestyle factors, a treatment is not likely to work or it will be harmful, then obviously it should not proceed. But we don't take these factors into account in prioritizing. That would be the end of the healthcare system as we know it, he says. If a doctor believes a patient could give up smoking and therefore reduce complication rates, they should encourage the patient to quit. But he says you cannot withhold an operation as punishment for not giving up. Many people are not able to give up cigarettes. It is a real chemical condition.
Okay. So if there are beginners, in the third paragraph, question statement says, so first thing you have to do as soon as you start your part C, number the paragraphs. 1, 2, 3, 4, 5, 6, 7, 8. First thing you have to number the paragraph. So when you have such questions, immediately you can reach the particular paragraph. Then Professor, here you see, you have name, right?
Yes, Father.
Yes, Father.
Course. When you have names, then you have opinion word. So, court says that treatment should be provided. First thing, do you have any idea here? Any strategy? First option?
Absolute.
All.
Absolute. Means what? Immediately you can eliminate.
Eliminate.
That will never be the answer. So one is less now. Okay. Treatment should be according to the necessity of the individual patient. Treatment should be provided regardless of a patient's lifestyle factors. Treatment should be provided once a patient has reduced their intake of cigarettes. Now, beginners, you have to write down these options like this. Professor Coates says that treatment should be provided to all patients based on a system of merit, and treatment should be provided according to the necessity of the individual patient. Treatment should be provided regardless of a patient's lifestyle factors. Treatment should be provided once a patient has reduced their intake of cigarettes. So you have to read every answer option in connection with the question stem. Then only you will understand the differences. Now here, what you have to do? Court says. Do you find court says somewhere? Court says, if you have the same. Yeah.
Court says lifestyle.
Court say. So you can immediately, if you have that expression, immediately you can soup to that area. Lifestyle factors should only affect the treatment in very limited circumstances, which means it should not affect. It means it should not affect.
Should not.
Lifestyle factors should not affect treatment. In a very limited circumstances means normally it should not affect. So you do have an opposite of this in the options.
Regardless of the patient.
Regardless of patient's life. This can be eliminated because that is opposite, right?
Yes, Father.
See, that
Limited.
treatment should be provided regardless of a patient's lifestyle factors. Any other option?
B.
B.
B for B. B
D,
for
what happened? D, what happened? D, once a patient has reduced their intake of cigarettes, do you have the reference here?
He says
But he says you cannot
He
many
withhold an
people are
says
not able
you
you
to.
cannot withhold an operation as
Many
punishment for not giving up. What does it mean? You
So
cannot limit the
it's
treatment because he has not stopped smoking. So this is eliminated. You have to write down these options and understand in the initial stages. Now only left is according to the necessity of the individual patients. Court says that treatment should be provided according to the necessity of the individual patient. Where do you have it?
fourth line says you give treatment based on the need and
Give treatment based on the need and how a person will benefit. Do you see a paraphrasing of that
that's the
option?
main factor.
Do you see a paraphrasing of this option?
That's the main factor.
You should give treatment according to the necessity of the
Based on
individual
the
patient.
need is
Necessity and need.
based on
Based on the need means based on the necessity. Synonym. Got it?
yes, Father.
yes for
Now,
the
while see you haven't got it in the sense you have to write down in your notebook all these four options and the opposite or the synonymous or the variant of where the reference is found in the text. Paraphrasing is important. Now, this is same. You give treatment according to him, according to Andrew Cross. You give the treatment based on need and how a person will benefit according to the necessity of the individual patient. See, it is the urgency of that need that is the main factor. That is the main factor, secondary factor, third factor, scale is there. Scale is used. This is the main factor. You understand?
Yes, Father.
So that is stressed again according to the necessity. You should give
Yes.
treatment according to the necessity of the individual patient, the need and the urgency. Is that cool?
Yes, Father.
Yes, Father. Yes,
Yeah,
Father.
here also you can see when you read, however, not everyone agrees. Professor Andrew Coates, Dean of the University of Sydney. What is that? What I have striked out, eliminated?
Compliments.
Compliments.
Subject compliments.
Compliments. Subject compliments of or compliments of Andrew Coates. Those you need not read at all. Normally, no answer will come from there. So you can strike it out and you can say Professor Andrew Coates says you do not arrange patients based on them being more deserving or less deserving. You give treatment based on the need and how a person will benefit. It's the urgency of that need that's the main factor. Do you have stamina for one more?
Yes, Father.
Yes, Father.
Yes, Father.
Yes,
Then
Father.
then this,
Father.
yeah, this is the last one, okay? Yes. Listen.
11. In paragraph 4, the writer believes that a team member present at resuscitation attempts A should provide the family with constant reassurance. B will find the experience as stressful as family members. C should focus on the patient rather than the relatives. D needs to explain the process to each individual family member. It needs to remain a personal approach, he says. What this way of thinking suggests is that regardless of research, witnessing resuscitation can be traumatic for all involved, particularly for family members. So it seems appropriate that health professionals explain everything that is happening, even more so that a member of the team, ideally the nurse caring for the patient in cardiac arrest, be designated for that role and remain with the family during the whole process.
Okay. Writer believes, opinion of the writer, that a team member present at resuscitation. What is important here?
A team
Team
member.
member.
A team member is important. What a need the team member should do, what a nursing in charge should do, what somebody should do. Should provide the family with constant reassurance. Will find the experience as stressful as family members. In your general sense, you know that cannot be the thing, right? Team member will not find the experience as stressful as family members, right? Being medical professionals, you have been seeing this every day. So, from your general sense, you can eliminate this, right?
Yes, Father.
Correct, no? A team member of a medical team member will not feel as stressful as the family member, right?
Yes, Father.
Yeah. No, that's
Yes,
just for
Father.
general understanding. We do not eliminate that, but let's see. We are just experimenting on our feelings. Then should focus on the patient rather than the relatives. Needs to explain the process to each individual family member. See, the context is resuscitation. When it is done, it's a very serious situation, right?
Emergency. Yes, Father.
Now
Cardiac.
needs to explain the procedure
Each-
to each individual. Means
No, Father.
that is absolute.
Absolute.
That's
Yes.
it's a sort of absolute expression. Can you now, instead of resuscitation, now you are going to explain there are 96 family members. You will call each one by one. It will take 3 days, right? So, no, from normal things also, that can be eliminated. How beautiful. Yes. Now only 2 are left. Should provide the family with constant reassurance. Should focus on the patient rather than the relatives. Now,
Can
where do you find? Do you find family members somewhere? See, particularly, there is a scale here. What does it say? That is important. Okay. So it seems appropriate that health professionals explain everything that is happening to the family members. Even more so that a member of the team will not highlight this. Even there is a comparison. What is it? Even more so, a member of the team. See, a team member. A member of the team is the synonymous of a team member. Ideally, the nursing. Okay, a team member is the synonymous expression of a member of the team. Ideally, the nurse caring for the patient in arrest. This is actually an explanation or compliment, you can say, of that team member. So you can ignore that. Be designated for that role and remain with the family during the whole process. Remain with the family during the whole process. Should provide the family with constant reassurance. Remain with
Whole
the family
process.
during the whole process. Constant reassurance.
Constant reassurance.
Is it okay?
Yes,
Yes,
Father.
So can you go for this?
Yes, Father. Father.
Should
Yes,
focus
Father.
on the relatives. See, should focus on the patient rather than the relatives.
No,
See,
Father.
relatives is not at all a concept here. Family members, okay. Relatives can be anyone, right?
Yes.
Now, here also you can understand in the context of a resuscitation case, can a team member focus on the patient rather than the relatives? Focus on the patient. Relatives is not a concept here. Family members, okay. They can eliminate, right?
Yes, Father.
So that's it. Thank you.